So yes, I mean, it's been another busy ASCO for advances in renal cell carcinoma. I think probably the most practice-changing abstract was a presentation by Dr. Ferrari looking at the use of pembrolizumab in the adjuvant setting for high-risk renal cell carcinoma using a year of adjuvant pembrolizumab versus placebo, showing a marked improvement in disease-free survival. Certainly, this will be practice-changing for our patients and will offer a novel approach in the adjuvant setting. And we'll have to think about how this is going to change therapy down the line in the first-line setting. But undoubtedly, aside from that, there are other advances in the treatment of renal cell carcinoma presented at ASCO 2021. I think one of the most notable abstracts was the long-term follow-up for Keynote 426. Again, this was a randomized phase 3 trial looking at the combination of pembrolizumab and axitinib versus sunitinib in those patients with metastatic clear cell renal cell carcinoma. And at ASCO 21, we have the long-term follow-up with a median duration follow-up of over 42 months. And I think what we see with this updated analysis to compare with sunitinib, the combination of pembro plus axitinib improved overall survival with a hazard ratio of 0.73. And we actually are seeing the median duration of overall survival has been reached at 45.7 months versus 40.1 months. The median progression-free survival was improved at 15.7 versus 11.1 months. And remarkably, the 42-month overall survival rate was near 60% with a combination, which is quite impressive when we think about where we started with renal cell carcinoma, 5-10 years ago. The response rate was maintained close to 60% with a combination, and the CR rate was at 10 versus 3.5%. So I think this is certainly very interesting data. It's the longest term follow-up we have for any VEGF IO combination with that median overall survival and then group at 45.7 months. And so this will give us some data as we look towards longer term follow-up from nivolumab and ipilimumab to really look at these different regimens and offer some context as we discuss these with our patients. Obviously, this is great for the frontline setting. Now we have multiple combination regimens that improve survival in the frontline setting, but we're always looking for novel approaches. And I think one of the things we were most excited about was the glutaminase inhibitor with telaglenastat. And so at ASCO 2021, we saw the presentation for the CANTATA trial, which was looking at cabozantinib plus telaglenastat versus placebo plus cabozantinib. And while there's a lot of hope for this, unfortunately, the trial was a negative trial with no improvement in progression-free survival at 9.2 months versus 9.3 months. So while this is obviously a very hopeful trial and the authors should be commended for pursuing this, unfortunately, it's a negative trial, and certainly we need to continue to do better in the second line setting. The trial did give us some interesting data, just looking at the activity of cabo in the second line setting in the modern era. And so this offers some important insights into the treatment of patients with metastatic renal cell carcinoma. I think beyond clear cell disease, I think one of the areas where we need to continue to improve is in those patients with non-clear cell or renal cell with variant histology, where we know that despite our advances in clear cell, patients with non-clear cell carcinoma sort of have a worse prognosis than their clear cell counterparts. And we saw multiple abstracts and presentations sort of focused on these patients. So we saw data for single agent nivolumab in a phase 2 trial, which, compared to what we saw pembrolizumab cross comparison, showed a response rate around 15% for single agent in patients with non-clear cell renal cell carcinoma. I think notably we saw data for nivolumab plus cabozantinib presented by Dr. Lee et al. And this looked at the combination of nivolumab plus cabozantinib in patients with variant histology renal cell carcinoma. There's two cohorts, those with unclassified papillary or translocation, as well as those with chromophobe. And in that first cohort, this unclassified papillary translocation, the response was actually 48% with a median progression-free survival of over a year, which is quite remarkable. We think of other VEGF IO combinations. We looked at the combination of atezolizumab and bevacizumab with response rate less than 30% in that population, broader population of variant histology renal cell carcinoma. So that's obviously very intriguing. And it's sort of the foundation for other trials that are ongoing. Dr. Lee has a trial in progress looking at the combination of that and pembrolizumab. And we actually have a trial in progress looking at the combination of cabozantinib with nivolumab and ipilimumab in those patients with variant histology renal cell carcinoma who have received up to one prior line of therapy. So we're obviously very excited about improving the care for these patients in this unmet population. So overall, I think ASCO 2021 has certainly offered us advances in the treatment of renal cell carcinoma and will certainly provide a building block for future trials and ideas. Thank you for your attention.